I'll start off by introducing our panelists today. We have Dr. Mick Connors joining us from Nashville, Tennessee. Dr. Connors is the CEO and co-founder of Anytime Pediatrics and a practicing pediatric ER physician. We're also very excited to have Aimee Valenti from Pediatric Partners, a pediatrician practice. She serves as the practice manager for the 8-provider group located in Highland Park, Illinois. So thank you all again for joining us. I will hand it off to Dr. Connors to get started. Hi, Dr. Connors.
Hey, Darby, how are you today? Thanks for setting this up, and Aimee, thanks for joining us. We just have 30 minutes today, so we'll be quick. We know that everybody is kind of overwhelmed with current chaos, and actually, I was talking with Aimee just before this, and I agree with her. It's kind of the new norm. We kind of have to be used to chaos where we are now. It seems like change is an everyday occurrence. So excited today to talk to you a little bit about how hopefully we can help as a partner at any time or with your telehealth programs to make sure that kids are being connected to the medical home and are seeing you and aren't going elsewhere. Darby, you want to go to the next slide? So as a pediatric emergency physician, I guess this is kind of why I got into telehealth, because I just see the medical home challenge and also the challenge to the medical neighborhood. So, a child needs care, and more we see patients that just go to the random provider, the random physician, the minute clinic, the urgent care, come to us in the emergency department, or maybe all those in one time. And so I think the question is, how can we get more kids to go to the medical home, to be able to see the medical home, reach out and be able to, access your care and stay connected to your practice. Certainly much harder when call volumes are going through the roof and folks are having a hard time reaching you or, getting any care at all and have a lot of concern and fear. So hopefully today we can cover some tips and tricks on how to help you. Next slide. So the question is, can you overcome the overwhelm? The overwhelming nature right now where call volumes are 4 times baseline. There's so much going on. I see it every day in the emergency department. I'm confused myself. Do I send an antigen test, a COVID test? Does this child need a RIDP? What do they need? Do they need to be seen at all? Saw a 12-day-old the other day in the emergency department that's been congested for a couple of days, no fever, no respiratory distress, nothing. They called the pediatrician's office, were sent to the emergency department, and the child waited 4 hours to be seen, got some nasal suctioning, and got sent home because they looked well. So it is always a question in my mind is how do we streamline this process better for patients, for parents, and for our practices. Next slide. So I'm a process thinker. I've in a variety of my career, both in the emergency department, with sedation services, with telehealth. I always think about the process. And I think that's one of the challenges that we have right now, because when things get crazy and chaotic, the process is often the thing that's the barrier for us and makes it a challenge. So I'd encourage you first to think about your process. The phone trees, the answering services, the fax machines. are they working? And, once things get busy like they are now, is that really where we need to stay as folks try to access our practices or our office? So we know parents, there's some good studies that show that parents aren't even calling offices anymore because it's challenging to get through. They may just go somewhere else because they don't think they'll be able to get in. There's over referral for care because I see this in the emergency department. There's no appointments available, or they called the office front desk and said, oh, your child sounds sicker, go on to somewhere else. You're getting these overwhelming phone calls. You can't bill for those. And often, you're referring folks on, so you're losing revenue and you're also losing patients. There's lots of folks out there that will tell patients they're not patients, that they're consumers, and they just need to go where it's convenient, and they go to other places that don't have the level of expertise that you have. So we have to think about this from a pediatric practice standpoint and technology standpoint of how we can improve our process and improve access for patients. So I think it's really important for us is, you know, I talked to a lot of pediatricians and certainly myself in the emergency department. I mean, we had 30, you know, like a 15% left without being seen rate the other night. And it's just really remarkable as we think about our process and our flow. So your child's sick and you call the office, and do you get into the phone tree? Do you wait on hold? Do you leave a message? Does the nurse call you back? Does the front desk call you back? Do we spend time scheduling an appointment, sorting out the best times? You know, oh, I don't have an appointment, or, you know, I'm a mom and I'm calling at 8 a.m. and the next appointment's at 5 p.m. and I don't want to wait that long. You know, so I've gone through all this and I haven't gotten any real care for my child or advice or those kind of things. And now I'm told to drive to the office and wait for care, whether it's in the car or, you know, those kind of things. Maybe some folks are using a little technology and have a patient portal and maybe can request an appointment or schedule an appointment. But when we begin to think about this from the patient side, it's really quite remarkable, some of the things that are, you know, we kind of stay stuck in our process and our flow. I was also talking to Amy about my ER experience the other night, because, you know, the patients have to come in and they have to be triaged and they have to be seen by a nurse and they have to be roomed by a nurse. And I was trying to room patients and they wouldn't let me, just because, you know, that wasn't the normal process. So as we think about things differently, with telehealth, with technology and with those things, we have to think, you know, are there ways that we can use what we have, or can we add things that we have that will streamline this process for patients, improve our access, and kind of keep them from going elsewhere, keep us from being overwhelmed, because we can work smarter and more efficiently and not spend a lot of time on things that don't need a lot of time, you know, if that patient can just kind of come directly in. So next slide. So when I think about this from a telehealth perspective, you certainly can do a patient phone call. The patient phone call can come in and can be routed right to a nurse, right to the front office staff, could be routed on to, you know, it doesn't need to leave voicemails and things like that. The more we can streamline this process, if you're familiar with Lean, it's a lot about pushing that patient along or pulling them along, as opposed to, oh, you got to leave a message and I got to call you back and I got to hope you answer the phone and do those kind of things. The more we can engage that patient right away, the better. And the other way is really with telehealth, because you can do the same thing with the Anytime Pediatrics app. If you're open for virtual walk-ins, you know, there's lots of great data, and we have it now, that you're not going to be overwhelmed with thousands of patients running into your virtual waiting room. But if you can get them into your virtual waiting room, you can do the same. The front desk can quickly evaluate them, or they can go to a nurse. You know, we'll talk about some clinical ways to kind of utilize that. If they need a physician, they can be referred on. We can think about that continuum of care of, maybe they don't need an appointment. Maybe they can be seen quickly via telehealth. Maybe a nurse can evaluate them and decide, hey, this is a kiddo we should bring into the office. This is a child that should be cared at home. This one just needs some education, you know, those kind of things. So you can begin to think about how to utilize and really triage or move those patients, you know, directly through that visit, as opposed to kind of lost in messages and phone trees and those kind of things. Next slide. What I would encourage you to think about is whether you want to be Starbucks or whether you want to be Chick-fil-A, and how you view yourself. So if you've been to a Chick-fil-A at noontime, pretty much anywhere in the country, they don't just sit at the window and take your order and wait for you to drive around and put it in. They actually have their own innovation center. They're constantly innovating on how to see as many folks as they can, be more efficient, drive things. They'll have patients out front. They have a mobile app. They have drive-through. They have come in and pick up your order. They're always thinking about process and flow and how they can move those cars through those lines, or get those patients their chicken. And I would think most people, you know, I think their chicken is okay, but I think what people really appreciate them is for their customer service, and they know that it's going to be efficient even if there's a long line there, as opposed to Starbucks, which I think is really fascinating, because when I go to airports or other places, they're kind of tried and true, and you stand in line and you wait in line, and you know, you either leave or you just kind of wait. And it's pretty interesting to kind of see the dichotomies, especially as we think about it from our pediatric offices, where many folks, you know, I talk with pediatricians, and I think we all feel the same. Like, is it convenience? Is it excellent customer service? Is that, hey, they should, if they want to see me, they should just wait for me because I got the best coffee, or I got the best care in the planet. So I think as we think about the future of telehealth and the medical home and how we can kind of combat patients going elsewhere, but also offer care in times of chaos and try to meet as many patients as we can and meet them with what we can offer them more efficiently. I would hope that we begin to think about how we incorporate telehealth and integrate that into the offerings. Because I think, as opposed to just all phone calls, there's a lot that you can offer via telehealth that can kind of streamline some of this process and some of this flow. Next one. So we can go on to the next slide. So I think the other thing that's quite interesting is, thinking about it, it's kind of like the 12-day-old I saw the other day. I mean, does every patient with congestion need to come into the office? Do they need to be seen? Or are there kiddos that absolutely need to be seen sooner that we're missing, or that don't need to be seen, right? So is that child with congestion, are they just congested, or are they retracting? Are they nasal flaring? Are they having difficulty breathing? Or do they look perfect? Do they look great? And we can just talk to parents about bulb syringe and suction and things to watch for and those kind of things. Same with rashes. I'm amazed how many rashes I see in the emergency department that quickly we could easily see, take care of, transition onto a nurse or a physician, and that child could be treated, right away. Next slide. We can talk about pink eye, we can talk about hand, foot, and mouth disease, sore throats, all those different things. I think there's an opportunity. People talk a lot about sick visits, which I think folks are overwhelmed with now, all the sickness, the COVID screening, who needs to come in for a test, who could come into our drive-through test, thinking about it just from a different way of how we can be more efficient in getting out of that. Well, they need to call the office. I need to schedule an appointment. I need them to come in, and those kind of things. And are there ways that we can more efficiently, think about it from a Chickfila standpoint? And are there ways that we can kind of meet patients' needs kind of where they're at? Can telehealth help us do that? Can we use nurse triage? Can we use the front desk? Can we use the physician virtual care to be able to do that? So my goal in my 10 or 15 minutes today was just to kind of get you to think a little bit outside the box, think about time wasted. What I outlined is something called a value stream map. And where is the value in what you're offering to patients? And are there ways that you can cut out that non-value add, that voicemail, that need to call back, those kind of things that could be moved much more efficiently through kind of the process and the flow? So without further ado, I'll turn it over to Aimee, who's the practice manager at Pediatrust at Pediatric Partners. And she's going to give us some frontline things that they're doing, I guess, in the land of chaos. So Aimee, I'll turn it over to you.
Thank you, Mick. So we at Pediatric Partners had introduced a couple different things. Prior to COVID entering all of our worlds, we had ideally wanted to use this as more of med checks, mental health, kids away at college way to reach out to our patients. We've continued to use it for all of these things, much more than we had even anticipated. But in addition to that, something that we started using pretty early on and is stuck with us and patients love is the addition of walk-in appointments. So we have what we used to have an actual walk-in sick time from 8 a.m. to 10 a.m. Monday through Friday at our practices. And we turn that into telemed walk-in. So it's a virtual walk-in, and we have our portal open and people pop in, and we have times designated in our templates for doctors or nurse practitioners to see those patients. Even though we're kind of a mixed bag now where people are also liking to come in, we definitely still have a high volume of patients that prefer the telemedicine visit and are more comfortable with that. And that's why we've continued to offer that as a definite option, as a first option, actually, to a lot of patients. The other thing that we've added in is typically we see sick patients also at the end of our day. And we've added in a block of time where we have telemedicine visits for patients that would prefer to do the visit portion, if possible, telemedicine. And then if the doctor indicates some kind of point of care test is needed or swabbing is needed, the patient then is scheduled just for that quick appointment in and out at the end of the day. So they can get in and out quickly and aren't having to come and sit in the exam room and wait longer. Most of our sick visits are only 15-20 minutes, but if you can do 15 or 20 minutes in your home instead of 15 or 20 minutes in our office, then I think that's a win for everyone. Some of the things that we primarily see are rashes, pink eye, etc. The video for that is excellent. The doctors are very comfortable doing those types of visits with the video with the patients, and I think they actually can get a better view in some sorts, because if it's a smaller child or a toddler running around, I think it's just easier without the doctor having to be in full PPE and the toddler, being able to be held on mom's lap in a comfortable setting. Some of the patients that have the respiratory complaints, they might not, as I had said earlier, some of them think they should come in, but we can do kind of a hybrid model where we do the telemedicine visit and then they just come in for the swabbing after the fact if needed. So I wanted to mention for what I had said earlier about the college kids. I know depending upon what state you're in, you might want to check with your malpractice and just make sure that that's something that you can do. But with our malpractice in Illinois, we are allowed to see any of our established patients that are in school out of state because we have an established relationship with them. So that's been super beneficial. And one of the things that we've also used, not necessarily in the med checks, but if there's a college kid who's sick, the parents have loved using that third party option with the visit so that they can kind of be there to see what's going on, because there's a certain level of parents being concerned about what's going on even with their college age students. So feeling like they're there with them has really been a bonus for our patients and their families. One of the other things that we offer in our office is we have a registered dietitian. That has been phenomenally popular to have the dietitian do the telemed visits. You're kind of in the home with the patient, and the parent and the toddlers or the patient and the family really seem to love that. It gives you a little insight. I would anticipate that even when we may forget what COVID is, that'll be something that definitely sticks with us, whether it's a hybrid of an initial visit being in person and then follow-up visits being telemedicine, because I think it's really beneficial to everyone involved in that situation to have that insight into what's going on in the home. We do a lot of consultations that are maybe more conversation-based consult time that are longer visits. We do a lot of that for telemedicine. I think it's everyone's more relaxed being in their home setting. And I think it's been a nice thing to be able to offer and has been beneficial. We have had many of our physicians using the potty training and the sleep training so they can see what's going on, as well as chronic issues, so that you can see the setup in the home.
Yeah. So Aimee, how are you handling the kind of the COVID? Like, I've got the sniffles. How do you guys handle that phone call?
So that phone call can be offered as a telemed or in person, whatever the patient is more comfortable with. Our patients are very aware that we offer telemed. They will do as much of that with the patient. Has there been exposure? Is there any other symptoms? What else is going on? And then it's really determined by each visit whether or not that's something that we would want them to come in and test for, or whether it's just kind of stay the course and follow up in a day or 2 days.
And are you guys using nurses to do that kind of triage and that determination of whether they need to come in or not, or are you going right to the physician?
Usually right to the physician.
Okay. So you're billing that as that's a visit, and then you kind of bring them in and test them in the way that they need to.
Correct.
And are you guys using nurse triage during the daytime? Do you have nurses that are screening patients that come in via
We do.
telemedicine on those walk-ins, or how do you do that?
So the process that we use with our telemedicine visits that are set up is we will have the nurse start the visit and do the chief complaint and get things going for the doctor and then hand it off to the doctor. We haven't used telemedicine just triage alone for the nurses. It's been combined with a visit that's set up for a physician or nurse practitioner.
Nice. And how are your call volumes these days? Are they still crazy? Are you still like in epic proportions of trying to answer the phone, or how are your
Yes.
patients reaching you?
The phone is continues to be the primary, no matter how many other options you offer. But as I said, I mean, we never really saw a downslide in the volume of the on-demand telemed. So people really do still like that, and that's very much appreciated by my front desk staff, that those patients are going right in there and they kind of are set to go, and we can communicate with the chat function to get them all set up and ready, whether it's that visit or we have to schedule them later in the day or something else is going on. But phone is always primary. We do have another third-party option that we use that helps with texting back and forth with our patients that we've implemented recently. And that is available 24/7 on our website. So then when we come in the morning, 7:30 to get ready for the office to open at 8, we have a half hour to kind of go through all those messages. And since we started doing it, which was just really this week, every day we've had, 10 to 15 visits sitting in there, or messages sitting in there that turned into visits that we were able to, a portion of them go telemed, a portion of them need to come into the office. But that's also really helped with call volume right at 8 o'clock as the phone goes on. So people don't feel like they need to wait for that button. They can just send a message at 5 a.m. if that's when they know they're going to want to bring their child in.
Yeah, no, that's great. And your walk-ins, can you are folks utilizing the virtual walk-in, or is it downtime, or is it, how have you seen that growth over time?
Yeah, no, I think the virtual walk-ins will continue to be popular. I think also people like that just because they know they can get an appointment at 8 a.m. right when the office opens, and their child can be in their PJs at home. So they kind of know what the course is going to be. I think it gives parents relief to get an answer, get a directive from the doctor right out of the gate. So they kind of know if they need to bring the child in, can they go to school? Can they go to daycare? Like what's going on?
Yeah, no, that's great. And I know there's always lots of fear of, gosh, there's going to be so many inappropriate requests for telehealth or a text message, right, that you're using now and that technology. How much is it helpful versus, gosh, it just seems like it's just in the way? I don't know. I'm trying to get your perspective on, utilization, parents' identification of how best to access your office.
We haven't had a lot of, there definitely have been some visits where they started the visit and the doctor determined that it would be easier to see in person, at which point we let the patient know. But no time is really, I don't think it was a dissatisfier in any way, shape, or form, because most of these visits are real time. So they're having the telemed early and then having time to be put in the schedule to come in. So it's really been a win-win, because our patients are very open to telemedicine visits. Our doctors and nurse practitioners embraced it with COVID. So I think our patients are used to it. So we've really not seen, I can't honestly think of a downside
Yeah, no, that's great.
to it. So
Yeah.
it's only been a bonus. I think patients are very appreciative that we're still offering it, that it hasn't been kind of put on a shelf thinking COVID is over, because it's not. So I think everyone's comfort level, they're appreciative. We have different ways to meet the needs of our patients.
Yeah, I think that's well said. I think certainly I've been at this for 5 years, so I've heard, we've certainly had the anxieties all along the way of, do I do telehealth? Do I not do telehealth? And is it going to be appropriate? And those kind of things. And I think, to your point, it just kind of, for the parent side, it kind of jumps them ahead of the value add, right? Because they immediately at least get some advice, or it's kind of like when I've experienced nurse triage, or, the parents are just so happy to get some idea of what to do in this crazy world where they're told to go to CVS or Walgreens or Teladoc, or don't go, or go to the ER, the urgent care. I mean, I think a lot of this is just, having some advice and guidance is incredibly important for them. So that's great. Darby, do we have any questions in the chat?
I don't see any questions in the chat now, but anyone can feel welcome to ask a question in the chat, and we'll have a couple more minutes for Dr. Connors and Aimee to answer.
Aimee, has it surprised you how, I guess the evolution of telehealth for Pediatrust, like where it's gone? I know COVID expedited a lot, but now we're 18 months into this, and it's still going on. Does it just feel like a whole different world, or
it does. I mean, we had started looking at it, and it was supposed to be kind of a slow roll in that turned into a steamroll.
For good or bad, right?
Yeah, but it was good, and then I think it definitely made all of our patients happy that they could still reach out to us with so many unknowns in the world. I think we've utilized it for so many things, like the potty training was kind of new to me that we had done that, but I'm like, how genius to help with that, to see the settings and kind of be able to talk, help the parent with whatever struggles they were going through, and the sleep training and stuff. So,
the other thing Dr. Sirota mentioned to me the other day was that she's doing a lot of developmental follow-ups in the home.
Yep.
And being able to see the child in the environment and those kind of things really has opened up things quite a bit for as far as those evaluations. So it is interesting to see. I'm amazed. We still have some physicians that are still kind of going back to the old way, but certainly Pediatrust, and appreciate you and Dr. Sirota and kind of continuing to push the envelope, because I think there's so much value add. From my ER perspective, it's great when we can get kids connected to the medical home, and they're there for the right reasons when they need to be. So thanks for all you guys do. All right, I think we're up on 30 minutes. Aimee, thanks so much for your time. Thanks for everybody for attending, and I guess we'll let everybody go back to chaos. Thanks, Darby.
Thank you.
All right, thanks everyone.
All right.
Bye-bye.